And because of that, people who are better organized, they are less stressed. Or people who are not organized at all, they are also less stressed. Yes, because they have no expectations. And they know that, okay, I am doing things, the result will come, it will not come, it doesn't matter. So this is important, that it is us who basically stresses ourselves. Unrealistic expectations. Now everybody has expectations, but it has to be realistic. I mean, in Ayurveda we say, you do your work and forget about the result. If you do it in a positive way, if you do it in a creative way, results are bound to follow. So, but the fact is, if we have expectations, and most of the time when we talk emotional health, we talk about the society today, all the problems with the family, separation with children, parents, divorces, all these separation with friends, fighting at workplace, the basic reason is expectations. Expectations between husband and wife, expectations between boyfriend and girlfriend, parents and children. It's like we expect too much sometimes. And then the other person is not able to meet our expectations. And then we start a problem. So the fact is, we have to make realistic expectations. And it's like, it's basically what we say, soothing the emotions. We will come to that point also afterwards. But it's very important for us to prevent many of these aspects just by changing ourselves. Yes, uncertainty about future, uncertainty about career, about our finances can also cause stress. But that also, we have to define where to draw the line. And fear, yes, fear is another aspect which is not defined properly, because fear can be of anything. But that is also basically negative thinking. Thinking about, we have fear of flying, fear of high-rise buildings, fear of driving into a tunnel, ghosts, whatever you can say. But this also, again, is a state of mind which is basically the discoordination or disharmony between mind, body and consciousness, what we call in Ayurveda. Now the symptoms of the stress. These are some of the symptoms that a person can feel, and if anybody have any of these symptoms, they can say, yes, they are into a classical definition of being stressed. Periods of irritability, like constant irritation or periods of irritation. Anger, everybody gets angry, but when you see that anger is their faster episodes of being angry, then we are stressed. I give you a very short, quick example of, like children, they play at home. They do all sorts of children behavior. They will take thing from here, put it somewhere, they will disturb your bedroom, they will disturb your office. But what happens that we start shouting at them, and we really yell at them, or maybe sometimes we can maybe put a slap on them, maybe a milder one. But if we think, sit down and think that, why are we doing this? I mean, the fact is, they are children. It's a very natural behavior of activity. But we should think that, is it them who is bringing this anger or irritation? Or is it something else? Something at our workplace, something within the family, something somewhere else, which is causing this, bringing this unusual anger. Otherwise, most of the time, we enjoy their activities. So this is the factors which gives insight that we might be stressed. Irrational behavior, sometimes very abnormal behaviors. It's very hard to define, but sometimes people feel abnormal behaviors. People do that. Low moods, very low. Don't want to talk, don't want to laugh, don't want to have fun in life. Lack of concentration, poor memory. Memory gets weaker. I mean, you start forgetting things often, more than normal. Loss of appetite, yes, the appetite also can be reduced. It happens very often. Low sex drive also is reduced. I mean, you don't feel like we say, reduced libido. Even if there is a proper situation, we feel that, okay, your mood is not up to that. That also is low sex drive. Abnormal eating behaviors. Either people can eat too much, eating too much chocolates, drinking too much coffee, eating abnormal times of the day. That's also stress. Dryness of the skin, and increased smoking and alcohol. People sometimes who are stressed, they smoke a lot. I mean, if they are smoking like say 5 to 10 years fall out of the stress, where we get anxious, nervous, we can have shaky, sweating, redness of the skin can happen, we can be either crying. A lot of these symptoms can happen during panic attacks. Either you can go on the other side, this is called depression, completely low moods, just close yourself behind the doors. Hypertension, which is called high blood pressure. Insomnia, sleep problems, not being able to sleep properly, or if even you are sleeping, the sleep is disturbed very much during the night. Impotency, where is a complete loss of sexual drive. It can happen both in men and women. Phobias, different types of fear we were talking. Now we are talking basically the disorders which we are diagnosed with these. Psychosomatic disorders, a lot of serious disorders can also happen because as a fallout of the stress. Serious disorders like Parkinson problems, Alzheimer's, multiple sclerosis, problems with schizophrenia, like where we call a lot of psychological disorders where you have to go under serious treatments as well. So they are long-term effects of the stress in Ayurveda, we say. So it's better always to prevent the problem or to burn the problem in the initial stages before we go into some serious disorders. PMS is premenstrual syndromes. A lot of women, especially young women and teenage girls, they suffer from this problem. And I've been traveling in Norway and I see a lot of young women having these problems with a lot of emotional swings before their onset of the menstrual cycle. They get fever, they get low moods, they get acne, they can get rashes, all these things. And you think, what's wrong? And the only thing is basically either they're stressed and that disturbs their hormonal physiology. And premature aging. I think anybody will not like to be aged before their age. So that's an important aspect, that if you are stressed and if we are stressed, that's just, okay, we are aging ourselves. So there's no point in doing that. Now we come to directly to the Ayurvedic view, what Ayurveda has to say. According to Ayurveda, mental and emotional health is brought, ill health is brought with an unwholesome interaction between the individual and the environment. I explained to you before also that it's basically us who defines and who are responsible for these factors. That it's an unwholesome interaction, that we want to do this at a certain